To the Wellness Weekend. My name is Dr. Philip Ross, and I'm one of the chiropractic physicians over here at the World of Wellness. And for today's topic, what I'm basically going to be speaking about is, I'm a chiropractor, and believe it or not, I see a lot of patients coming in with low back pain. So what we're going to do today is I'm kind of just going to discuss like the most common forms of low back pain and kind of just do kind of like a small anatomy review, so to speak, just so you guys can understand where I'm coming from when we talk about what we do for the rehab, the supplementation to take, and basically the like what we do to treat it in the room as well. So, for you guys tuning in, if you've never seen me before, I'm a chiropractor, but I also went for a master's in sports rehabilitation, and I also got something called a CCSP, and a CCSP stands for a Certified Chiropractic Sports Physician. So that doesn't mean that I just predominantly treat athletes. Treat all walks of life. My youngest patient I've ever treated was 2 years old, and my oldest patient I've ever treated was 99 years old. So that's what's cool about my job is, just with my background, usually treating a ton of athletes. I actually just got done with one of mine right before this topic. We basically take all those principles and tailor it towards everyday folk because let's face it, if you are working in the garden, if you got grandkids at home that are keeping you active, those are all athletic movements. So we kind of just use those principles and just give them to basically everybody, and everybody responds pretty darn good from it. So okay, we're going to talk about low back pain. So, what I kind of want to start off with, everybody's probably heard of the sciatic symptom, right? So, hey, doc, my back's hurting. I kind of feel like a little bit of pain in my butt, my glute region. It kind of shoots down my leg to my knee or to my foot. And I will basically talk about what is going on, like the mechanisms of why you're feeling that, and basically how we're going to get you feeling better. So, I just bought a little model. So this is a model of your low back, and this is a model of a disc herniation. So when we're pertaining to the disc, you have basically, we'll call it the jelly inside the jelly donut. But what the jelly is something called a nucleus pulposus. And researchers, when they talk about it, it's actually kind of feels like like a toothpaste consistency. That's the jelly, and then the donut. It's something called your annulus fibrosis. So roughly, give or take, depending on the person, there's 22 to 24 layers that basically contain the gel like substance inside the disc. What happens during like a disc bulge or a disc herniation is you have micro tears of those little rings running around, right? So 22 to 24, and they're poorly vascularized. They don't have a good blood supply. So usually, like people that have any kind of disc issue going on, you'll actually have micro tears in there, but you won't know it just because you don't really have a ton of signaling for that. But then it's kind of like the last straw that broke the camel's back. When that last layer tears and then the disc property comes out, that's when you're going to have all your symptoms and all that pain. So very, very common. When that disc property comes out, it contains 8 main inflammatory proteins. We'll just call it chemical soup. And so when the chemical soup hits the corresponding nerve, the nerve actually swells like 3 times its normal size. I don't know if you guys can see that there. So that is basically like a pinched nerve, if you will. Whether it's pinched from a structural standpoint, or if you have a disc herniation or a disc bulge, and the chemical inflammation or the chemical reaction is that nerve actually swells 3 times its normal size. With that being said, there's a couple things that we could definitely do in the treatment room, and then there's a couple things that you could do at home as well for that, and supplementation as well. So, just going back to the disc, when we talk about the disc, very, very common if you have a disc bulge or disc herniation. You don't have to have an MRI to confirm it, even though that's the gold standard. But basically, just with like some of the testing that we do in the room, and based on some of your symptoms, we kind of infer where your disc problem is in your back based on the radicular symptoms running down the leg. So, when we talk about different radicular symptoms running down the leg, usually when people come in with an MRI, or if they're coming in, they're like, my back's hurting. I kind of feel it in my glute, behind my knee, all the way down to my foot. Depending on where your symptoms are running down your leg, again, we could infer where your damaged tissue is, whether it's a pinched nerve or too much compression of a disc. And we'll kind of, I use something called a class 4 therapeutic laser. To make a long story short, because I'm going to talk a lot about it tomorrow, is basically just going to help to decrease the inflammation at the cellular level. So it's almost essentially, you could think of the analogy as we're trying to basically shrink this nerve back down, just so you're not having that radicular something running down the leg. So usually laser is like one of the biggest things I'll do for a disc bulge or disc herniation. And then I also love giving different kind of like home exercises you could do. So one of the biggest things that I give patients is core stability exercises. My favorite core stability exercises: love dead bug, bird dog, Pallof press, and then you could do your front and your side planks. Just because the stronger your core is, the less load you're actually going to put on the disc in your low back. So I'll usually send people home with core stability exercises, and I guess we could talk just a little bit more about what the laser does for that radicular symptom running down your leg. So you have three channels on a nerve. You have a potassium, a calcium, and a sodium ion channel on a nerve. So think of when you're having that back pain running down your leg, shooting down your leg. Think of a straw with a bunch of holes in it. It's kind of leaking, so that nerve, it's called depolarizing, so it keeps firing and running down your leg. What the laser does is it gets on, when we laser the corresponding nerve root. It essentially closes up the calcium ion channels in the nerve, so it's basically plugging up the holes in the straw, so you have a better signal, so that symptom's not continuously firing down your leg. People get a ton of great results with that. Depending on how bad the disc bulge, disc herniation, or pinched nerve, they're kind of all one and the same. Depending on how bad it is in your low back, usually people feel a lot better after around like 4 treatments from the therapeutic laser. But sometimes if you have a little bit more prominent of a problem and it's a little bit more significant, then it will require a couple more treatments. But that is definitely going to help a take care of the inflammation of that nerve, and B, it kind of brings all your body's good healing properties and factors to that area, so you could heal a little bit quicker too. Um, so that's basically what we use the laser for, kind of just to turn off the calcium ion channel on the nerve, and it will decrease the inflammation. Um, and also too, getting back to the disc, very very common that you have a disc injury if your symptom is, hey, I actually feel good when I'm up walking around, but if I'm sitting in my car for too long, if I'm sitting in my office chair a little bit too long, that's when I really start to feel the back pain and it running down my leg. And there's a reason why. So if we look at the anatomy of a disc, you have the most pressure in your disc in the seated position, second most laying prone, so laying on your belly, third most standing, and then you have the least pressure on a disc when you're actually laying on your back. So very, very common when patients, if you have any kind of a disc injury, usually you get the most symptomatic relief if you're laying on your back and kind of like bending your knee a little bit, because it's taking strain off of that sciatic nerve or that corresponding nerve root, and it has the least amount of pressure on your disc. So what I like to send people for take home exercises too, if you don't have any kind of any kind of like eye problems or any kind of like congestive heart failure or cardiovascular problems, I recommend inversion tables. I would suggest looking on Facebook Marketplace or uh, what's the other website? Facebook Marketplace or Craigslist, eBay. Just because you could spend a couple $100s and go get an inversion table, but usually people try and get rid of those, and you could get one relatively cheap. And I would also suggest, if you're going to do the inversion table, have someone there the first time you do it, because it's not uncommon when someone gets on it and they're by themselves at home and they invert and they're like, oh crap, now I can't get up. So I would definitely have someone there. And my other suggestion, if you get on an inversion table, let's say this is your head and these are your feet. A lot of people, they'll, the first time getting on, they'll just go straight up and completely 180 invert. That's a lot of pressure in your head, to be honest with you. Like, I'm not a fan of that. So I usually tell people, if this is your head, maybe you just work in like 15-degree segments. So maybe go down and hang out and do a rep, so to speak, for a couple seconds, about 30 seconds, come back up, and then you could kind of go a little bit further each time. And that's a really, really good way that you, at home, that you could basically decompress your low back if you have too much compression in your discs. Another way, if you don't have access to an inversion table, and we got a question, let's hear it. Great question. Yes. So if you don't have money for an inversion table or space, like the next best thing that you could do is, I'm a huge fan of dead hangs. So if you go to the gym or if you have like an I beam in your basement, you could basically just dead hang from a pull up bar, and it's the same thing. So usually a disc bulge or a disc herniation is too much compression in your low back. So when you go and dead hang from a pull up bar, you're basically using gravity to kind of open up and just allow your disc to breathe a little bit. But that's a great question for sure. Not a problem. Lastly, if you don't have access to that, or if you have a bad shoulder or zero grip strength, you could basically just have your spouse or a family member or friend, when you're laying on your back in your bed, you could basically kind of just brace yourself on the bed and have someone just grab right above your ankles and kind of just slowly traction you to. So essentially, what we're trying to do is decompress your low back, because if you have any kind of disc injury, it is usually due to compression of your low back. So we want to decompress it, right? So that, in a nutshell, is kind of what goes on with the anatomy of a disc bulge, disc herniation, pinched nerve. They're all kind of one and the same. The biggest things that you got to do is the decompression. We'll use a therapeutic laser, and then we were talking about the core stability muscles, yin with the yang. The stronger your core is, the less the less these huge muscles, these erector spinae muscles, basically have to stabilize, and the less low back pain you're going to have as well. Okay. And so if it's not coming from a disc, so see a lot of disc patients coming in here. Very, very common as well, in the younger population. Hey doc, my back's hurting me when I'm golfing. I kind of feel it right on this knot in my back. It's not a knot. It is something called a sacroiliac joint. You have two of them. You have a left and a right, and it makes it pretty easy for the provider, myself and Dr. Orbach, because there's something called orthopedic exams, right? And they have specificity and sensitivity. Not a lot have really high specificity and sensitivity. Besides, it's kind of funny, like with an SI joint, it's very, very easy for me. Just diagnosis in the room. They're like, yeah, it doesn't run into my butt, doesn't run into my hamstring. I kind of just feel like right on this knot, that SI joint. That I would have to say, Dr. Orbach, is probably low hanging fruit. Yeah, low hanging fruit. I love those just because patients respond super, super quick. Basically, just do a side posture adjustment, diversified, and that really clears it up. But when we're talking about the, whether it's the sacroiliac joint, that SI joint, or if it's coming from a disc, myself and Dr. Orbach, we're just basically not treating that structure. We're actually treating the adjacent structures around. So very common that people have something called lower cross syndrome, and it's basically like a muscle imbalance. So you actually could be getting your back pain not from a traumatic experience or an injury, but basically just from faulty biomechanics and you sitting too much. So what I like to do is do some muscle testing to see what muscles are too tight, and then I do a lot of manual therapy on those tight muscles, basically just so your pelvis can kind of realign how it wants to sit. And we do that with a couple different things. So I also do something called cupping therapy. We do something called instrument assisted soft tissue mobilization. That's just a fancy word for kind of like trigger point release. And then also do something, what we get a lot of results from is something called pinning and stretching. So essentially, if your muscles are tight just because you've been having back pain for weeks or months, we can treat the disc and we can treat the SI joint, but you still might have lingering pain just because the muscles now are becoming a pain generator, right? So what I like to do is almost kind of like a deep tissue massage. We use a couple toys in the room to kind of help with that. And then I also, that pinning and stretching, essentially what we're trying to do is we're trying to shorten the tight muscle, pin it and stretch it back out just so it puts more slack in the rope, so to speak. So getting back to most common presentations of low back pain, we were talking about the disc bulge, disc herniation, and having the radicular symptom. There's two components to it. So it's an inflammatory response. So I'm not a huge fan of steroid usage, but if you are a 9 out of 10 or a 10 out of 10 pain, so hey, I can't sit, I can't get in and out of my car, it hurts to roll over in bed, I can't sleep, it's waking me up at night. Those are some of the patients that I might say, you know what, maybe go to MedExpress and get a prednisone or a Medrol dose pack, just because a oral steroid, like a 5 to 7 day steroid, is going to nuke your inflammation systemically. So if you come in with a very, very hot low back, as I like to call it, sometimes we won't even be able to treat it until you get your inflammatory response down. We got a question. We got a comment. Correct. Correct. Yeah, yeah, absolutely. And there is a reason for the medical profession, and there's a reason why steroid packs are around, because if you have such a, severe symptom, like if you're not sleeping, if you literally, it's like a pain to get out of a seated position, getting in and out of your car. you let's face it, you need a catalyst to kind of get the ball rolling. So that is a good short-term relief. So like same thing that applies with the low back, the neck too. Patients coming in, doc, my neck's killing me. Like I can't get any relief out of my arm. I feel like I have to shake it out. The only time I get relief is putting my hand on top of my head. Reverse Bacote. That is usually indicative of a disc bulge in your neck. And usually I'll tell patients, I'll be like, hey, you need to get on a steroid just for 5 to 7 days just to nuke the inflammation so we could actually treat you. Because when you have such a hot low back or hot disc in your neck, there's not too much we could do just because you're in so much pain. So I basically like to get the patient to get the inflammatory response down at first, and then you could follow that up with nutraceuticals. So one of my favorites is our X-Flame and then our Inflame. So those are two massive anti-inflammatories. Again, getting back to the disc, you have chemical soup. So we basically have to get rid of that chemical soup so that nerve could kind of shrink up so you don't feel the pain running down the leg. Lastly, too, so say your back feels immensely better, right? And legs feeling better. Your symptoms are starting to centralize, like we like to call it. So getting the symptoms out of the periphery, making its way up to the source of the injury or the pain. The other supplement that works in really good conjunction with our anti-inflammatories is something called neuropathies or neuropathies. I don't know how you say it. But long story short, what that's going to do is it is basically for peripheral neuropathy, and it basically helps to repair the nerve. Very, very high in B vitamins, specifically B6 and B12. And again, that's basically going to help that nerve to kind of repair itself. So you're not feeling that ridiculous symptom running all the way down the leg. Side note too, like my diabetic neuropathy patients, I love putting them on that as well. And then people with any kind of just like hypersensitivity, like you know what, when I wash my face, it just kind of feels like my face is just like very sensitive on one side. Probably coming from your neck, but also they do really really well with the neuropathies. Um, and then last thing about the disc, when we were talking about how you kind of feel that pain running from your back, running all the way down the leg. Um, I also like to send patients home with corrective exercises outside of the core stability stuff. And with that, there's something called McKenzie's End Range Extension Protocol. So it's basically a group of docs that came up with basically a way to treat the technical diagnosis is something called a lumbosacral radiculopathy. All that means is low back pain running down an extremity. They came up with a huge protocol, basically how to treat that. And myself and Dr. Orbach know a thing or two about the McKenzie End Range protocol. And that's why I always tell patients, if you're seeing me, bring your phone in just so you could take a video of me going through the protocol, or I'll film you going through the protocol. Because let's face it, if you have something going on like that, us treating you in the clinic once or twice a week, that will significantly help, but you're going to have to do some homework on your own. And so I'll usually tell people to, yeah, film me or I'll film you doing the exercises, because it's very common that someone comes in and I'm like, hey, how you feeling? Did you try those exercises? And they're like, I forgot everything you did. So if you have it on your phone, you cannot forget. And so we'll go through different corrective exercises. I love, there's also something called a neuromobilization. It's called a nerve floss. Essentially what that's doing, you're trying to put more slack in the rope, so to speak. So if you have that sciatic nerve that's pain in the back, pain in your butt, running down your leg, we could give you different kind of neuromobilizations. We'll just call it a nerve floss. Just again, different ways that you can move your head and your foot, so you're putting more slack in the rope so you don't have the pain running all the way down the leg. So the main goal with any kind of disc injury is we're trying to get the pain to centralize. So get out of the periphery and kind of up to the origin of where it's coming from, your back, and then it will go away. Side note too, if you're a patient listening to this struggling with any kind of low back pain, the sooner you come in, the better. Some people, they'll be like, I tweak my back, I kind of feel it in my glute, like my butt. It went away and then it came back, and now I kind of feel it in my hamstring. And then they wait till it's like the last straw that broke the camel's back, and they're like, okay, now my leg's on fire, it's all the way down to my foot. You get a lot better. It's a lot better prognosis, and you respond a lot quicker, in my opinion, if you come in when you initially kind of feel the symptoms, right? So please don't wait until your leg's on fire, you can't sleep. It's hard for you to basically move around. Please nip it in the butt, so to speak. So if you're having it kind of in your back and you feel it going into that glute region, come in instead of putting it off, because that will get a lot worse. And then, you're just going to have to come for more visits, more treatment, and we'll just nip it in the butt sooner and later. Um, last thing that I wanted to talk about pertaining to most common symptoms pertaining to low back pain. So we covered what goes on with the disc. We covered what goes on with the SI joint. SI joint too, like it's just not a cookie cutter approach, even though it's a simple joint chiropractically to treat. Sometimes people might need manual therapy, loosening up structures around the SI joint. But on the inverse side, sometimes people actually might need some basically exercises to kind of strengthen everything around because their SI joint, just basically all the musculature is not strong enough. So that's why I would suggest coming in if you're having that kind of pain, just so you could see myself or Dr. Orbach and we can make the call based on your exam. Hey, if we're going to give you strengthening exercise for it, or if we're going to give you loosening exercises for the musculature at hand around the SI joint. Okay, so we covered those two. And then lastly, stenosis. A lot of people coming in over the age of 50, 55, 60 come in and they bring their x-ray of their low back and they say, I have stenosis or I have osteoarthritis in my spine. Um, Being realistic, if you moved at all or played sports when you were younger and you are going to be in like your mid 50s, you probably are going to go get an x-ray or an MRI and they're going to say that you have two different things, something called DDD and DJD. What does DDD stand for? That stands for degenerative disc disease, and DJD stands for degenerative joint disease. We'll basically just call that arthritis. And stenosis, in my opinion, is also kind of a form of arthritis as well. So what is stenosis? Stenosis is basically you got your vertebral column, right? And your spinal cord runs through down it. Where this runs through, basically, it's a form of arthritis. Why? Because that space starts to narrow and close. And then that's when people have the symptoms. Hey, my back's killing me. And I feel like I can only walk for 10 or 15 minutes. Then my legs start to hurt. And I feel like I got to shut down, sit, and kind of rest. There's a couple things that we could do for that in the clinic as well. There's different kind of stretching and exercises that you could do to kind of help open up that space. And then I usually give kind of like a decompression protocol for patients struggling with that as well. And they do respond great. So like if you go get your x-ray, or if you went to someone and they're like, hey, you have degenerative disc disease or degenerative joint disease, it's not the end of the world. I would say a lot of people, like we were talking about, over the age of 50 probably have a mild form of that. There's a ton of things you could do. Don't worry about that. Don't think of that as like a death sentence. And that's what's sometimes hard about seeing images from patients as well. I feel like if you get an image and they say something like that, and then you go to Dr. Google, you freak yourself out. Realistically, that's a totally treatable thing. Myself and Dr. Orbach, I mean, probably see 5 or 6 of those daily. I would say on a minimum. So yeah, there's definitely things we could do for that. You just got to get your butt in the clinic and we'll get you treated to kind of suppress the fire and suppress the symptom, so to speak. And then we both like to go over different corrective exercises and basically just different ways to kind of approach your life, right? So if you're doing something that, we kind of think is probably chewing your back up, we're going to tell you about it and give you some, a different exercise that you could do that should help your low back. um and then yeah, once that's resolved, and especially when we were talking about like the disc, right? So it basically kind of like micro tears in the disc. You're not out of the woods yet, and a lot of people always ask too, they're like, hey, I'm feeling a lot better, my leg feels better, is this going to come back? Yeah, it could definitely come back just because you already have micro traumas and micro tears there. But the more frequent you come in, and the more we treat you, the less likely when that disc bulges or herniates, the less likely that you're going to have like that intense of a symptom, just because we already did most of the groundwork for you, right? So um, I guess that's what I kind of wanted to talk about in a nutshell. The different forms of arthritis in your low back. Again, if you went to another chiropractor, or a surgeon or anything, and they said, "Hey, you have DDD or DJD," don't freak out about it. It's actually pretty darn common. Stenosis, same thing. As you get older, as gravity compresses down on your spine. So let's say you're sleeping 6 hours a night, right? So 18 hours a day, you basically have gravity compressing down on your spine. That's why I'm a huge advocate of, if you have the room for it and the money for it, getting an inversion table, just because yeah, yin with the yang, right? So gravity's compressing down all the time. So if you get on an inversion table, even every other day for like 5 minutes and invert, it's basically going to open everything up so you could kind of keep those nice juicy disc in your low back. Um, when we say juicy disc in your low back, I guess side note, it's funny when people are like, "Yeah, I went for to renew my license and I shrunk 2 inches. Like what the heck's up with that? So basically, your disc is like it's I mean, inside that nucleus pulposus, the jelly inside the jelly donut, it's basically water, and so your disc will dehydrate over time as you age, just because of gravity compressing down on your spine all the time. So even if you don't have low back pain, like myself, I knock on wood, I have no low back pain right now. But even though I don't, I still get on an inversion table. Why? Because again, we're trying to yin with the yang. We're trying to reverse all the compression from day to day with decompression from the inversion table. And then again, getting back to the SI joint, trying to think my most common patient population I see SI joints in. I would have to probably say like younger population, 20, 30s, 40s that are exercising in the gym, golfers, your weekend warriors, if you will. That's a little bit more prominent that I'm seeing patients coming in with that. And then the disc properties, just what we were talking about. You have the most pressure in the disc in the seated position, second laying on your belly, third most standing, the last mount laying on your back. The older you get, the more compression you're going to have on your disc just because of gravity. And then let's face it, everybody now, today's day and age, we do a lot of sitting. So the more you sit, especially the older you get, you're not as active as you once were. That's basically just going to kind of flare up disc too. So I would have to say my young adult slash middle age population, so anywhere from like I'd say like 50s to like mid 60s, that's when I'm seeing like a lot of the disc things going on. And again, like not crazy hard to fix depending on where your disc is at and what your symptoms are. But I'm telling you right now, like you're not going to have to come in 3 times a week for a whole month, and then twice a week for the next month. Like usually we could kind of get everything kind of suppressed and settled down, so to speak, within a couple of visits. And then I definitely recommend maintenance care as well. It doesn't mean you have to come in, every other week, every 3 weeks. Sometimes people, it works for good for their body, just coming in like once every 4 weeks, once a month. Just because we were talking about once the disc is healed, we basically have to kind of work on the adjacent structures just to make sure, they aren't becoming a pain generator as well. So that I guess is low back pain in a nutshell. So we covered the disc, the SI joint, and then the forms of osteoarthritis in your spine too. I guess the take homes from this is if you're having any kind of disc problem, please come in because the longer you wait, the worse it's going to get. Same with the SI joint. You don't want to just kind of, hey, I felt it for a couple days golf and it went away. Felt it for a couple days golf and went away. One of my good buddies, he's guilty of it. He will have that happen to him, and then he will text me basically like, "Hey, I can't get up off the floor. Can I come in like now?" So don't wait to that point because then you just have a lengthy recovery. Come in and get treated, get adjusted, definitely get looked at, and then we could give you the corrective exercises and home care, so to speak, that you could do at home. And then I'll end with the supplementation for it. So if we're talking about any kind of disc thing going on, highly recommend a natural anti-inflammatory. Our X Flame's great, our Inflame's great. Also, too, if it's like a local SI joint, our topical CBD does really well. So a lot of patients ask, "Hey, can I get the CBD here, or is it just as good if I go to the Sunoco across the street and get it?" No. So our CBD, it has something called lipodermal technology. So it's a transdermal cream. So if you ever go to like if you ever heard any family members or friends, women that went through hormone replacement therapy, sometimes their endocrinologist will actually give them a cream that you could kind of rub on your skin to get your estrogen or your progesterone. We actually use the same kind of lipodermal technology in our CBD cream. Without the hormones, we actually just put CBD in it. Why is CBD massive? If it's kind of like like a local pain, it's a massive anti-inflammatory and a neuroprotectant. There was a testimonial we had with Dr. Len. He came in and we treated him once he had something called lateral epicondylitis, tennis elbow. To make a long story short, we did some pinning and stretching in a couple different muscles, lasered them, and then started using the cream. And he literally went up within just one treatment, 30 pounds out of his grip strength. That was pretty darn crazy. And he said it's feeling pretty good. And next time he comes up to Pittsburgh, he actually wants me to work on the other one because that's getting him a little bit of trouble. But Yeah, I would say for the anti-inflammatory properties, that would be more indicative if you're going to be taking something orally. That would be for the disc. If it's that SI joint, I would say you could definitely use the dermal cream, the CBD transdermal cream. And then lastly, to prevent the progression of any kind of like arthritis in your spine, right? Whether it's osteoarthritis, whether it's the DDD, DJD. We have something called HA plus. HA plus, what's cool about it is a lot of patients ask, "Hey, it's hyaluronic acid. Could I just buy that on Amazon?" Yeah, you can, but I would also recommend that you take glucosamine, MSM, and chondroitin as well. And if you buy all of those separate, you're probably going to be spending more money on all four of those as opposed to just getting the one HA plus. That's what's cool about Nutritional Frontiers. They make it easy for the practitioner like myself and for the patient because they try and basically put everything in one. So could you go out and buy four different individual supplements? Absolutely, but it's super simple, and you're more likely to take it if you're basically just taking it out of one supplement bottle instead of breaking up into four. So that's what I would say to kind of prevent the progression of any kind of joint arthritis would be the hyaluronic acid. And then lastly, if you're having any kind of low back pain and it's not coming from the disc, it's not coming from the SI joint, but you kind of have like some tendons and ligaments that kind of just seem like they're loose. Actually, my last athlete just in, he just separated his shoulder, and we got him on. I like Ligaplex One by Standard Process, and then we also have Green Lip Muscle as well. And that's basically just going to kind of help to strengthen in the structural capacity of tendons and ligaments. So, I guess if you're struggling with any kind of low back pain, I would suggest coming in to see me if you never seen me before. We could kind of do a comprehensive exam to see exactly what's going on. I treat a little bit more conservative, so if there's no red flags, I'm probably not going to send you for an X-ray or an MRI right off the bat. We'll probably treat you conservative, but then if you're not progressing like how I like, you should be feeling immensely better in like 4 to 6 visits. And if you're not there, then something's wrong. So then we'll probably send you for like an X-ray to see if there's any kind of underlying structure, like potential cysts, like a dermal cyst. Or any kind of anything else that could be pertaining or making your low back pain worse. But yeah, come in, get checked out. I'm here Monday, Tuesday, Wednesday, Friday. My longer days are Monday and Wednesday, 9 to 7. But yeah, I would say if you're experiencing any kind of low back pain, come in. I know I kind of just rambled for about 35 minutes, but I love when people that listen to these talks and presentations come in and then they actually get in the treatment room. They're like, dude, I didn't know you do all that stuff. Just because, again, I am a chiropractor, but I like to use a couple different bells and whistles if it's in our scope of practice. So why the heck not use everything that we could do, basically just to enhance your healing capability? And instead of you getting better like this, you're going to start to get better like this and get back to like what your hobbies and like uh, to do what you want to do, I guess. So all right, guys. Thanks for sticking with me. Tomorrow, I'm going to be talking, Phil, I think at 11. And that's when I'm going to kind of dive into some of the modalities we have to offer here at the World of Wellness. So I'm going to touch base about the Class 4 therapeutic laser. We're going to talk about our PEMF mat, just kind of a preface. So PEMF, what it stands for, pulse electromagnetic fields. So it's basically like, in a nutshell, my favorite way to describe it to patients is you're basically like recharging the batteries of your cell. And that actually got really popular, NASA. So when the astronauts were basically going up in outer space and coming back down, they had all kind of like health problems. Bone density was down, and so they actually started implementing that with NASA and putting on the space shuttles, which I thought was pretty cool. So there's actually a lot of good literature for any kind of neurodegenerative disorders for the PEMF mat. I have patients that I put to help treat their symptoms of MS and Parkinson's on that. And, call in, or we could even talk about it if you're in the room. If you don't want to buy one, because they could kind of get kind of pricey, there's a couple websites where you actually rent them and basically rent them for like anywhere from 45 days to 90 days. My two Parkinson patients that I'm currently treating to help suppress their symptoms, they're actually renting theirs. I think they rented them from 90 days, because the more time you get on, the better it's going to help. So Again, that's basically kind of recharging the batteries of your cells. And then I'll go over the Normatec compression boots. I lived in those after the half marathon. That really helped. And then we'll talk about our infrared sauna. And then lastly, we'll talk about our whole body vibration plate. A lot of people like to use that for lymphatic drainage, but I kind of like to use it to get into the nooks and crannies of basically like the terminal end range of motion of your joints, so to speak. So thanks for sticking around.